And he was admitted. He's got type 2 diabetes and heart failure. He's single, never married, no children, lives out of state. He's in town for 2 weeks visiting with his cousins. He's allergic to iodine. He is a full code. His last vital signs were in the PACU at 13:20, and right now it is, let's see, it is Thursday at 13:30. Okay. He had a wound debridement. Okay, I'm looking for.
And his vital signs at
on his right
13:20 were normal?
Mm-hmm.
Okay.
Yeah. His blood pressure was a little elevated. Let me tell you, his blood pressure is 142/94. His pulse was 92. His heart rate was 22. His O2 sat was 94%. He's on 2 liters of nasal cannula. His pain was a 7 out of 10. And they debrided his right foot and heel. He's alert and oriented. Cardiac regular rate and rhythm. His respirations were fine. He's had no complaint of nausea or vomiting. He has not voided since coming out of the PACU.
Was he giving something for pain, since his pain was 7 out of 10?
That was before anesthesia,
Oh,
so
okay.
he's just coming out of the PACU.
Okay.
We need to address that.
Mm-hmm. He's slightly anxious. He seems to worry a lot, and that was prior to surgery. Okay.
Did he express any particular source of worry?
No. And let's see here. His activity is going to be bed rest, dangle foot over the side of the bed in the evening. He's 88, diet is tolerated.
What was Wells tolerated? What was the last one?
Diet is tolerated, 88.
Oh, okay.
Anything else you want to know?
Yes, I want to know when his last glucose was tested, since he's a type 2
Okay.
diabetic.
So his next glucose level is due at dinner time.
Okay, glucose at
Okay.
dinner.
Mhm. And his
what-
last one, hang on and I'll tell you. If I can find it. His cousin James is at the bedside with you. He's a patient of Dr. Buss's. And I'm sorry I don't have that.
That's okay. And did he wake up after surgery?
Yeah.
Okay, so he's no problems with that.
Yeah.
Okay. And also, I was gonna ask something. So does he have orders for a dressing change? No,
No.
because he's just coming out. Okay. And is he on antibiotics? Just the ones I have on here?
Uh-huh.
Okay. Mrs. D, is he gonna speak, or are you gonna speak?
I'll speak for
Okay,
him.
for him.
through
Okay.
him.
Okay.
We were wondering, is the box to operate him that's on this side? Don't touch it.
Okay, that's for his vitals.
We
Okay.
thought so, but wanted to make sure.
Any other questions?
No.
Okay. I'll go on the
Yeah,
other-
yeah. I noticed his labs are normal, but what about a white blood cell count? There was none in there, so he hasn't had one?
Oh,
No. There's nothing.
Yeah.
Okay then. I think that was it.
Okay.
Okay. So what's his name again? Mr. Hedding?
Hedding Matthias?
Matthias?
Mathis? Mathis.
But his last name is Hedding?
Yeah.
Okay.
Mathis Hedding.
Okay.
Yeah.
Okay.
I'm scared.
I'll wait till she's ready. Should we come in real quick?
Yeah.
can start at any time.
Okay, ready?
Yeah.
Okay, we're starting. Okay. Hello, Mr. Hedding. My name is Angelica, and I'll be your nurse today.
Hi, I'm Kayla, and I'm here to help Angelica.
And how are you doing? How are you feeling?
Okay.
Okay. So can you tell me your name and date of birth?
My name is Matthias Hedding.
And your date of birth?
I'm not sure.
Okay. Do you know where you are right now?
It's August 14th.
August 14th. Okay. Are you having any pain?
I am having some pain. It really hurts.
Okay, on a scale of 1 to 10, what would you say your pain is?
Oh, about a 9.
A 9. And where is your pain?
Well, you know where they operated on my foot.
Oh, okay. Other than that, you're doing well. Okay, so what we're going to do is we're going to go ahead and just take your vital signs, and we're going to go ahead and assess the area where you had your surgery. Okay? So the first thing we're going to do is,
Don't touch my foot. It really hurts.
okay, yeah, we're going to be very gentle. We're just going to take a look at the area. We want to make sure that there's no drainage or anything like that. So if we could go ahead and take your blood pressure and your pulse, and if we could activate that, please. Okay, and so I'm assessing the patient, and he looks normal. His skin is normal from what I can tell. He looks, he's not having any difficulty breathing. And right now we're assessing his vitals to see if there's any temperature.
Should I maybe get going on the blood pressure?
Yeah, okay. Go ahead and do the blood pressure. We're gonna go ahead and assess.
I'm gonna take your blood pressure. Just go ahead and keep your arm relaxed.
Okay, and I'm gonna go ahead and just take a look here. Okay, I'm gonna go ahead and take a look at your foot.
Oh, be careful. It really hurts.
I will definitely be careful. I'll definitely be careful. Okay, so I'm gonna go ahead and get my gloves on. Okay, and if it's okay with you, let's raise the bed.
What?
Let's raise the bed.
Let's do that.
Okay, we're gonna go ahead and raise your bed. And I understand you haven't gone to the bathroom. Do you feel like going to the bathroom? Any sensation?
No, not really.
No? Okay. I'll wait till you do that and then I'll raise the bed. Okay,
It would work.
yeah, I think you just have to close it. Is that all the way? Yeah, it's closed. Okay,
Try this one.
it's not working. Okay,
Ladies, remember you can use the monitor for your vital signs.
we can use the monitor.
Go through the motion.
We don't have to take it.
Okay.
Okay, we're gonna go ahead and raise your bed up a bit. Okay, and okay, so I see that he had an O2 oxygen, okay, and that seems to be working just fine. We're gonna go ahead and take a look at your leg here. The first thing I'm gonna do is I'm gonna just feel for temperature, okay, and then I'm gonna assess for pedal pulse. Oh wow, you work.
Be careful. That really hurts.
Okay, I'm sorry, I'm just feeling.
Pulses is about 90 and a little bounding. Would you like me to get those IV fluids running?
Yes. Okay, I have it at 72. Okay, I'm gonna just take a look at your other leg. I just want to compare. Okay.
There's nothing wrong with my other leg.
Absolutely not. I just want to compare and just make sure that that they both look fine. Let's Okay, I'm gonna do a capillary refill. Okay, this one is less than 3. Okay, I'm just being very gentle. Okay, now I'm looking at the dressing and the dressing's fine. I don't see any drainage. I don't see any redness and I don't see, I do see it's slightly tender. I'm gonna just take one more pulse right behind here.
Come on this side.
Okay, I don't feel it, but. Okay, and there's not,
Is it not running?
I'm sorry?
What are you doing with my ID? Is it not running?
It's not running. Are you feeling any tenderness right here where I'm touching by around where your IV site is?
No.
Okay, well, we're gonna get it back running again, okay? Can I have you tell me your name and date of birth again so I can make sure it's for you?
Science Hedding. August 14th.
And what, do you have any allergies I need to be aware of besides the iodine allergy?
Oh, not that I know of.
Okay.
Is there a thermometer? Or was that included?
I don't see.
Okay. Okay, so I want to take his thermometer. So would that be already on here?
IV line flushes easily, no resistance. Positive return.
I think she said I have to take it. I want to know if he's running a fever because he just.
Okay.
This is gonna work. I think she'll just tell you. I know. What is his temperature?
Temp is 98.2.
Okay. All right, his temperature's 98.2, so I don't have to worry about that. Okay, let's, he said his pain was a 9, so we're gonna,
My foot is really hurting.
okay, what we're gonna do is we're gonna go ahead and, give you some pain medication, and so, we're just taking a look at the orders. Can we put ice on his thing to help with the pain?
I don't see why not.
Okay, we're gonna also get you some ice, and we're gonna place it, to see if that helps.
Do I scan the bracelet too?
Yeah.
Stretch it. Which one? No, there's a it says click. Hold on. Okay. Click here. I did click. Did it work?
I think so.
Okay, now scan the medication. Oh, it said proceed with that. Hold on, I clicked the wrong button.
Okay. We're just giving you your medication, and that's gonna help with the pain. Are we supposed to elevate him?
Okay, how long will that take to happen?
Give me 1 second. What is he getting? Oral medication?
I'm getting the IV going back.
Oh, it's gonna be an IV, so that's.
The Tylenol is PF.
Okay, we're gonna go ahead and give you some. First, we're gonna start your IV, and then that'll
please.
we'll get that going, and we're gonna give you some Tylenol.
I'm just gonna
And
go
does he have
without
order
this.
for morphine?
Hold on one moment. My barcode scanner is not working. He does have an order for morphine has not been given. The dose is 2 milligrams IV.
Okay, we're also gonna go ahead and give you some IV medication, and that will work better than the oral medication. It'll work faster. Okay?
Whatever will work fastest, because my foot really hurts.
Okay, we'll go ahead and get the medication. Your leg looks good, and we'll get you the pain medication. And she really wants this to elevation. I'm gonna go ahead and get his morphine.
Okay,
Okay?
go ahead.
All right. And so he's only allergic to that. Okay, so you said the morphine's on here? Okay, it's the morphine injection every 2 hours, 2 milligrams. 2 milligrams is non-inferior. Okay?
Did you do an abdominal assessment?
Not yet.
I will do that while you
Thank
get
you.
that ready.
Okay, I'm gonna go ahead and get your medication going. Thank you.
I'm gonna go to the other side, give you some room.
And this is for your medication, okay? So can I have your name and date of birth again?
Yeah, I've had to tell you so many times. My name is Matthias Hedding. My date of birth is August 14th.
Yeah, I'm so sorry about that. It's just protocol. I'll get you this medication so that you feel better.
Have you listened to lung sounds, heart sounds?
Not yet.
Okay, I'm gonna start doing that. Mr. Hedding, when I put my stethoscope on your chest, could you take a big deep breath in for me, please?
Okay, I will.
You could just breathe normally now, listening to your heart. I'm just gonna feel your belly. Are you having any tenderness?
No, my belly doesn't hurt.
Alright, I'm gonna lift up your gown and take a listen to see if I can hear your stomach sounds.
Okay.
Okay, I'm gonna go ahead and give him his medication.
Okay.
Since his blood pressure is 139 over 94, I'm gonna go ahead and give him his morphine. Should I get these on?
Does this medicine work fast? Because I really hurt.
Yes, this medication should be working within a few minutes, and so you may feel a little bit of, drowsiness with this medication, maybe a little bit of dry mouth, a little bit more relaxed, but it will help with the pain, okay?
I'd like to listen to lung sounds on the back when you're done.
Okay. So I'm going to go ahead and administer the medication, and it's called morphine. Okay. And I'm going to just take a look here. So does it go in here?
Yes.
Okay.
Make sure you pinch off the other line.
Mm-hmm. Thank you.
Are you flushing twice or once?
Once. But since it's running, I don't think we have to flush.
Right.
I'm going to go ahead and pinch this off. And then I'm going to go this.
Mr. Matthias, how are you feeling with everything?
My foot really hurts. Is that my pain medicine?
That is your pain medicine.
Actually, I'm flushing it right now. And this will be your pain medicine.
Wasn't I supposed to check that?
Morphine?
Isn't it a high alert?
What is it? Okay. So should I have you check it?
Come verify.
Okay.
I'll help you verify this morphine.
Yeah. And it's 2 milligrams, and it's morphine.
2 milligrams.
Morphine every 2 hours, and last given.
Okay.
Okay.
I'll put it in the system for you.
Thank you. I did scan it.
Okay. The barcode scan is not working.
Okay, just give me 1 second.
Does this not come off? What needle did you use?
I get my pain medicine.
Did you use that injection?
It's hurting.
Yeah, I know it's hurting. I'm coming right now.
What was the pain? 9?
Yes, he was a 9. Okay. So I'm ready. Okay, let's get this. I think it's over 2 minutes, right?
Mm-hmm.
Okay, we flushed it. That's fine. Okay, and okay, I'm gonna look at the clock. So another thing that's important that we're gonna need to do, because you just got out of surgery, is we're gonna need to have you use your incentive spirometer, and that'll help a lot to help you with your breathing, and so to help you get better faster also, and it prevents complications, breathing complications. So we're gonna have you do that as well. Does that sound good?
Okay, but do I have to do it right now? My foot really hurts.
No, we're gonna wait until the medication takes effect, and then we'll come back and we'll have you do it after, once you're comfortable. And so it's very important that after your once you get better, we'll show you how to do your dressing changes, and to help you take good care of your foot and your extremities, especially with diabetes. Do you smoke?
Used to, I don't anymore.
Oh, that's great. That's great, because that would delay your wound healing. So that's a good thing that you don't smoke, and and so that would really help. And so we'll help you how to take care of your foot, because circulation is very important.
When you put on your shoes daily, it might be useful to use a mirror to look at the bottoms of your feet, so you don't have to bend down and look, just so you can look around and make sure that you have no wounds.
Okay, that's kind of a good idea.
Also, are you active? Do you walk a lot, or what do you do?
I probably don't take very good care of myself.
You can talk to your doctor, but start with something light and gradually work your way up. Maybe something a couple of times a week once you get better. We also have physical therapy. They'll probably be coming, and they'll be coming to help you with your moving and range of motion. And so that'll also be important. And we can also teach you on some of the exercises that you can do. But that'll also help increase the circulation, and it'll also help. It'll also help with the circulation to your extremities, and it'll help prevent these type of incidents occurring. Do you monitor? Are you feeling better, by the way? What is your pain level?
I'm getting kind of sleepy.
You're getting dizzy?
Sleepy.
Oh, sleepy? Yes, that is.
Sleepy.
I'm gonna get a respiratory rate, but I can't quite see it.
I know, it's hard to see when it doesn't. You're getting sleepy. Okay, well, okay.
Yeah, I'm just gonna take a nap.
Okay, that's probably the medication, okay? That's the medication, so, yes, it does have that effect. So as long as your pain level is better, that's what we care about. We want to make you comfortable. Go ahead.
Okay.
Would you be comfortable sitting up? I'd like
Go ahead
to
and call it here, girl.
call it here.
Call it here? Oh,
Is that what she said?
yeah.